Hello, my name is Veronica Ajewale. I'm an associate professor of pharmacy practice and the director for the Community Engagement Core of the NIH-funded Center for Biomedical and Minority Health Research here at Texas Southern University. I want to say a big thank you to you and the community members for joining us for today's program. We are really excited that we will be sharing a lot of great information alongside the experts or speakers and panelists that will be leading us into this conversation. So please have your questions ready. We would have an opportunity to take your questions after today's presentations. So thank you again for joining us, and we look forward to our continued collaboration. Thank you.
All right, good morning, everyone. I'm Virgil Elkins, project manager for the TSU CVMHR, and welcome to our health education event, Navigating the Healthcare System, Making the Most of Doctors' Visits, Preparation and Community Strategies, or communication, excuse me.
Texas Southern University's Center for Biomedical and Minority Health Research Community Engagement Core is funded by the National Institute of Minority Health and Health Disparity Research Center for Minority Institutions program. The CEC works directly with communities to identify and address health-related concerns and reduce health disparities related to ethnic minorities. We provide health education and partnerships with healthcare systems, federally qualified health centers, community and faith-based organizations. For more information, visit us on social media at CEC Texas Southern U, or give us a call at 713-313-1233, or send us an email at cbmhrcommunity@tsu.edu.
All right, so how's everybody doing today? Good. Everyone looks wonderful and beautiful here, so I'm glad and happy to have you guys here. I'm extremely excited about today's presentation. We have a lot of information for you guys, a lot of pertinent information that'll help you all through your medical visits, things of that nature. So just to kind of reiterate what Dr. Ajewale talked about earlier, there will be a Q&A period after our guest speaker, as well as following our panelist discussion. For those that are online, please make sure you click the link online. There will be someone tending to the Zoom as well. And so if you have any questions, place them in the Zoom. We'll get to it after the speaker does his presentation, as well as the panelists do their presentation as well. And then also, if you guys signed in the front of the building there, make sure you have your notepads to kind of hold on to those questions and pen. If you don't have a notepad or a pen, raise your hand and we'll get someone to bring that to you. One, two, couple over here. Okay, we'll get someone to bring that to you shortly. Before we get started, I want to say thank you to our partners and vendors. Mr. Jonathan, he actually just stepped out. I was hoping he'll come in so I can acknowledge him and recognize him, but we are partnering with Precinct 1, Rodney Ellis, Commissioner Precinct 1. And just to give you a little information behind their background, their mission statement is Precinct 1 is committed to becoming a national model for delivering responsive public service that utilize inclusive, innovative, and collaborative approaches to improve the quality of life, advance equality of opportunity, and promote the fair treatment of all people in Harris County. Their priority goals and objectives are Precinct 1 strives to incorporate equity, fairness, and justice into all of our priority goals and objectives. Advancing equity, fairness, and justice for all depends greatly on creating policies that dismantle oppressive and discriminatory structures, doing effective outreach, organizing and empowering the communities we serve, and effectively communicating with those policies in our work by demonstrating their benefit to our entire community. Thoughtful and insightful narrative which reflects our response to the needs of our entire community aspires to create dynamic public dialogue through effective and timely messaging. If we'll take a quick break to acknowledge Mr. Jonathan Leong. Jonathan, you'll wave and say hello. Everyone, please give it up for Jonathan. We really appreciate you, representative of the Senior Citizens Coordinator here at Precinct 1. Thank you, Jonathan. Also to our sponsors, Aflac, Walmart, and Aetna, we also thank you as well for your contributions to the department as well as the program. And also to the director, who's not here at the time, Dr. Veronica Ajawale. I want to acknowledge her, as well as Dr. Nkechi Agbo, who's here on the side. Dr. Agbo, thank you. And then also another team member, Miss Dolores, who is here in the back. So again, if you guys need anything, please let us know, and we'll be welcome to oblige you. Okay, so welcome to the Navigating the Healthcare Systems Health Education Seminar. Just to give you a couple of reminders, if you've picked up the surveys already, please remember to turn those surveys in at the end of the presentation. If you don't have them yet, they'll be on the back table here. Dolores, if you'll hold them up for us. They'll be available to you at the back table at the end of today's presentation. You can scan the QR code to sign in online. If you haven't signed in already, before you leave today, if you'll sign in out front. And then also for our attendees online, if you will sign in using the link that is in the chat box. Without further ado, let's get started with today's presentation. I'd like to introduce to you our guest speaker, Dr. Ken Yonda from University of Houston College of Medicine. Dr. Yonda is a professor of practice in health system science and population health at the University of Houston Tillman J. Fertitta Family College of Medicine and a lecturer at Rice University's Jones College School of Business. He teaches the essentials of health systems, insurance, and healthcare financing to medical and MBA students. He is passionate about connecting every Texan to quality and affordable care. Prior to joining the University of Houston, Ken served for 11 years as president and CEO of the Community Health Choice, a nonprofit health insurer that included over 400,000 enrollees in Medicaid, CHIP, and the ACA's subsidized individual marketplace. A 40-year veteran of the health industry, Ken previously held executive positions with health insurers, Prudential, Aetna, and Humana. Ken is also a warrior for health equity and founder, managing principal of Wild Blue Health Solutions, a Texas-based healthcare consultancy. Wild Blue focuses on advancing new care and payment models for traditional healthcare and social determinants of health, increasing coverage options and connecting our most vulnerable populations to healthcare access. He holds a BA from Rice University in Anthropology, Economics, and Managerial Studies, and a JD, a Juris Doctor, from University of Houston Law Center. He's a native Texan and raised in Belleville, Texas. Small town roots, big city perspectives. Married to a high school sweetheart for over 40 years, father of 2 and grandfather of 5. Without further ado, Mr. Ken Yonda.
Thank you very much, Virgil. I really appreciate the introduction. That's embarrassing to that. So let's get rid of that slide right away. But you know, the reality is I've been involved in healthcare and healthcare financing for my entire adult life. And I know I don't look it, but I actually just had my 69th birthday. So, you know, I'm still kicking and still enjoying what I do, and still, even though my wife recently retired, since we were high school sweethearts, you might figure out her age. I never say her age, but since we go back to high school. But, you know, she wants me to slow down, and I can't slow down because I feel this real need. I feel partially responsible for spending 44 years on the healthcare side, and over that period of time, I would say it's just gotten more complicated, more messy, and so how do we make sure everybody has access to care and knows how to navigate it is just really important to me. So I want to do a little bit of introductory stuff. Don't worry if some of this stuff, like this is really complicated stuff, but we'll go back and cover some of these again in the panel discussion. And so just hang in there for a minute. So we're going to talk a little bit about the of Medicare and the different options. I wanted to throw in a little bit of complication about some of the other things that might be available to you and resources that you can use. Then we'll have a little bit of question and answer just to sort of clarify my presentation before we move into the panel, which will expand on what I'm talking about. So, you know, the first thing is it's a complicated system. And I promise you don't need to memorize this chart, but there's a lot of public financing, both federal and state government for healthcare, and all these things like the CDC and the NIH and the FDA and the HHS and CMS, and all these acronyms that just drive you crazy, right? There's the VA, there's Medicare, Medicaid that are both, and then there's private financing from private insurance companies. And increasingly, these are sort of getting blended together because more and more the private insurance companies that I've worked for over the years are now involved in Medicare and Medicaid, and more people on the federal programs are actually administered through private insurance companies. So it's, it's complicated, is the point here. And, this chart only has one line here for all the providers, and this by itself is complicated in terms of Memorial Hermann and individual doctors and Harris Health System and Methodist and HCA and all, it's really a mess, okay? That's all you can say about it. And so that's why there's a lot of people that are involved, and we'll have some on the panel today to actually talk about how to help you guys navigate this crazy system. I always want to remind people that, about 2/3 of Americans have private insurance through most of them through their employer, and about 1/3 are on either Medicare or Medicaid programs. And still, there's over 8% of the people in the country have no health insurance at all, and those are the ones that worry me the most, because that without insurance, it's very difficult to access the system. But that 8% is the average for the country. It ranges from 3% in Massachusetts to 18% in Texas. Texas has both the highest percentage and the highest number of uninsured people of any state in the country. So Texas, when I talk in my bio about Texas, Texas is big enough and a bad enough problem that I don't even try to worry about the other states. I just focus on Texas. But it starts to be a little bit more understandable if you think about this. So along this, the bottom, you have babies to old people, okay? So this is kind of an age on this side, and this is income level going up this way, right? So very low income people to the rich people that I don't worry about, okay? Sorry. But so you have Medicaid generally for low income people that are not eligible for Medicare. But you also have Medicare for people who are over 65. And so we'll talk in a few minutes a little bit more about what we refer to as dual eligible people, who are both Medicare and Medicaid at the same time. But generally, if you think about it, low-income folks, Medicaid, oh my gosh, that was bad. So see if I can hit only this button. So low-income folks should be eligible for Medicaid. Over 65, eligible for Medicare. If you're low-income and over 65 and in a nursing home, you get both. There's a CHIP program for some lower income families that don't qualify for Medicaid for their kids. There's the Affordable Care Act that provides subsidies, both in terms of premium subsidies, as well as subsidies on deductibles and co-payments and those kind of things for lower income folks. Up here, almost all of these folks under age 65 have private insurance through their employer. And then in here, you get sort of a mix of folks. So that's what it's supposed to look like after the Affordable Care Act in 2014. Unfortunately, Texas was one of the states that did not fully implement the Affordable Care Act. And so part of the reason why we have so many uninsured people is because Texas did not extend Medicaid to low-income adults, as we should have and eventually will before I die. I mean, I'm just determined to get that done. So Texas is a lot messier, but generally follows the same guidelines. And if you're wondering about the different income levels, again, this is very confusing to people, and but there are people that will help you work through which programs are at what different income levels. And so this is just, again, you don't need to memorize this chart, but just know that it's challenging, and it's different for getting a subsidy under the Affordable Care Act versus getting Medicaid versus, and if you're kids versus pregnant women, it's different eligibility requirements. It's just a mess, okay? That's all you need to remember about all these slides is it's really a mess. It's way too complicated. And of course, in Ken's fantasy world, I know how to fix this. Unfortunately, politically, we don't really have the ability to fix it right now. So let's talk about Medicare, because I hate to say this, but a lot of you look like you're over 65. So we're going to focus mostly on Medicare today as we talk. So Medicare is a federal program. People over age 65. There are certain people disabled under age 65 that are eligible, and people that have Lou Gehrig's disease or end-stage renal disease, even if they're under 65, are potentially eligible. So, and then of course, Medicare is not just one thing. There's Medicare Part A, which is for hospitalization coverage, and Medicare Part B, which is generally for physician services. Part C is an opportunity for you to buy private coverage that replaces Part A and B with a private insurance company. So Aetna and Cigna and United Healthcare, Blue Cross, all those guys offer a Medicare Advantage plan, and we'll talk a little bit more about those in the next slide. And then since 2006, you also have prescription drugs covered under Medicare Part D. Very often, if you select a Medicare Advantage plan, A, B, and D are all rolled into one plan. There are deductibles for the different programs, so you do have to worry about deductibles if you're just on traditional Medicare. And there is co-insurance under Part B as well. And Part D, again, very confusing because there's lots of different options that you can pick. Okay. Wait, what happened here? Well, my thing that shows what the premiums are cannot be right now. But generally for Part A, you've already paid for Part A while you were working, so you don't pay a monthly premium for Part A. It was part of your your Medicare taxes that you paid while you were working. Part B, there is a premium that you have to pay every month, and it is about $170. Is that $174? It changes every year, so it's $174 right now. Oh, it says it right there. It does say $174. Okay. So that's what it is right now. There are some higher income people that have to pay more than that. Most people actually have it deducted from their Social Security check, so you don't actually have to write a check each month. Part C, if you buy a Medicare Advantage plan, you generally, first you still have to pay your Part B premium. You still have to pay that $174. But you may have to pay a slightly additional premium on that, but some of them you don't have to pay any additional premium for. And prescription drug program, because they're all done by different individual health insurance companies, the premiums there, you can get a prescription drug plan for $10 a month, or you can spend $100 a month, just depending on what's covered, what drugs are covered, what your co-payments are, what your deductible might be. So it's a lot of variability in these. So as you thought Medicare was simple, right? A lot of people I talk to that are about to turn 65, recently, both of my brothers turned 65, and they're like, okay, so what do I do to sign up for Medicare? And it's like, well, harder than you might think. So we'll talk about that in a minute. Generally Medicare does not cover things like, which is why long-term care, if you're low income, is paid for through Medicaid instead. Medicare doesn't pay for most dental or eye exams or dentures or cosmetic surgery. Again, there's some options for you if those are important to you that you can buy up for. So this is the important chart of this, and I should have made copies for everybody, because this is sort of my roadmap of how you do this. So I'm turning 65, or it's annual enrollment time, which comes every fall, and so you got to make a couple decisions. So there's some of us that will make this first decision. I work for the University of Houston. I just turned 69. I am not on Medicare. I still have employer-sponsored insurance through University of Houston, okay? So what they want you to do is sign up for Part A, because it doesn't cost you anything, but if you're still working like me, don't sign for Part B, because I don't need that $174 each time. And actually, in my case, because my income is kind of okay as being a college professor, I would actually have to even pay more than that. There's some additional things that higher earners have to pay. So I'm eligible for Part A, but generally I still have the University of Houston Blue Cross policy. The second choice that you have, if you're not actively at work, is to just to do traditional Medicare Part A, B, and D. And so you sign up for that. As I mentioned before, Part B is deducted from your Social Security check. You have to go out there and pick a Part D plan off the website. Most of these plans, then are going to be, you can go pretty much anywhere, especially for Part A and B. Virtually all doctors and hospitals accept Medicare, and so you can go pretty much wherever you want to go from a doctor and hospital standpoint, but you will have cost sharing, right? If you only do Part A, B, and D, you're going to have that $1,600 deductible if you get hospitalized. You're going to have that $240 deductible for Part B, and then 80/20 co-insurance, okay? And you won't get any dental or vision coverage, okay? The next thing you can do is say, well, I want to do traditional Medicare, but I want to buy a Medigap policy on that. And what a Medigap policy is, it adds on to reduce the deductible that you have to pay. It reduces that $1,600. It reduces the deductible and co-insurance on Part B. And there's several different options there that you have, but that is also through an individual insurance company, and you have to pay the monthly premium to those insurance companies. So Part A, or Medigap policies tend to be expensive. You can easily spend $500 a month on a Medigap policy. So they're actually shrinking in terms of the numbers of those. And instead, what more and more people are doing, in fact, over half of all of people on Medicare now, and almost 60% of all the Medicare eligible people in Texas are actually in Medicare Advantage. As I said before, you still have to pay your Part B premium through your Social Security deduction, but then you pick a carrier like Aetna or Blue Cross or United Healthcare, or here in Houston, Kelsey Care offers a plan as well, a few others. You pick a carrier pretty much by who's in the network and are my doctors and hospitals that I want in that carrier. And if it makes sense, then you will have a lot less cost sharing, because all these Medicare Advantage plans dramatically reduce the deductible and co-insurance that you have to pay. Why do I have such a hard time with this? My clicker. So the other reason why people pick Medicare Advantage is that you get value-added benefits with most of them. You will get some dental and vision care potentially. Of course, you're going to have to put up with the hassles of being in a managed care plan. You might have to have prior authorizations and things like that. You're going to have to stay in network. You never want to go out of network. If you have a Medicare Advantage plan, even if it says that it's a PPO, don't go out of network. Most all the Medicare Advantage plans include prescription drug coverage, so you don't have to buy a separate Part D plan. But generally, it costs you a lot less than having Medicare and a Medigap policy. But I will tell you, don't try to do this on your own. And this is not a commercial for one of our other panelists here, but you need to find a trustworthy broker or agent to help you navigate this. Or a navigator, somebody that does this professionally, because you can really get yourself in trouble if you don't. I consider myself a bit of an expert on this, but still, when it comes to me, I talk to a broker friend who does this every day, because she knows it in and out and where you can get trapped. Because what I should have said at the very beginning, there was a little disclaimer on my very first slide that said, I'm giving you the general rules. There are exceptions to every one of these general rules. And so, there's always a nuance. There's always something a little bit different about it. So, but this is generally what you have to decide. If you do decide what you want to do is stick with traditional Medicare and look at the Medigap policies. As I mentioned, these are Medigap policies are sold by Blue Cross or United Healthcare or folks like that. And they'll help you reduce your deductibles and co-payments and co-insurance. But you have to already have a Part A and Part B signed up in order to get one of these. And it's, Medigap is different than Medicare Advantage. Okay, these are two different programs, even though a lot of companies sell both. Again, why you should have some help. And there's standard plans, and I won't try to go through what the difference between a plan A, B, C, D, what happened to plan E. Anyway, but anyway, there's 10 standard plans with various combinations of what additional deductibles and copayments they're going to cover and those kind of things. Plan F tends to be really very comprehensive, and so that's like if you want everything, but it's usually the most expensive because of that. And one of the things that you can do, good at going online and looking at stuff. The federal government does really a pretty good job of their websites and stuff, but I don't try to do that by myself. If you're interested in Medicare Advantage plans, you can buy a Medicare Advantage plan in the Houston area from Aetna Blue Cross, a company called Devoted, Humana, Kelsey Care Advantage Memorial Hermann has one, Molina, what's now called WellCare, which I still remember as Texan Plus, Anthem, WellPoint Plan, and United Healthcare is probably the biggest one here. They have a cozy relationship with AARP, and so they get a lot of business through that. So if you're going to consider, and you get to make a decision every year. You can jump from one plan to the next this fall if you don't like the one you're in now. But obviously, these different companies, some of them are pure HMO plans, meaning you only have benefits if you use the network. Some of them say that they're PPO plans, which just means that you have a lower deductible, lower co-insurance if you go to their network, but you still have coverage if you go outside the network. I used to be a big fan of PPOs. I'm not anymore because you sometimes get caught with other surprise bills if you're in a PPO. But almost all of these will reduce or totally eliminate your deductibles and co-insurance, but you may still pay co-payments when you go to the doctor's office. And as I said before, most of them will also include the pharmacy benefits so that you don't have to buy a separate one. And you will get these value-added services, so it's like, dang, everybody should do this? Well, the problem is you got to use their network, right? And so you got to make sure that your doctor and and you might have specialists, or there are certain hospitals that you want to use. They may not be in the network. And it is an annual election, so you can change each year. What I would say, if you're in a Medicare Advantage plan though now, and you want to go back to traditional Medicare and get a Medigap policy, that sometimes is a little bit hard because they will do a medical questionnaire for your Medigap policy, and you may have to pay more for it, or they may say, no, thank you, I don't need you. So that's Medicare Advantage. I will tell you, as I mentioned before, Medicare Advantage is growing very rapidly. This is what is now. This is 2023. In 2024, it's even higher. It's about 53% of. And in states like Texas, it's between 50 and 60%. Texas may be the next state to flip. Well, Texas and Florida are about to flip into being more than 60% of the people in Medicare Advantage plans as opposed to traditional Medicare. Okay? And obviously Medicare is growing, so it's really important to doctors and hospitals because the population of the United States is aging. Overall, right? There's some, for those of you who think system-wise like me, the congressional budget will flatten out 60% across the country. I don't think so. I think it's just going to continue to grow. Okay, so here's another one of these extra complicating factors. If you meet the requirements for being disabled, and perhaps we can have some more discussion about the definition of disability from a Social Security standpoint, you may be eligible for what's called a special needs plan, or as those of us in the business call it, a DSNP. This is a special Medicare Advantage plan that has some additional benefits that are covered for disabled people. So I do just mention that they're out there because, and what's actually a good thing that goes on in Texas is a lot of the Medicare special needs programs also are in the Medicaid program. And so if you're one of those dual eligibles, a special needs plan is a good way to go. Okay, so generally Medicaid is for seniors. It's generally for pregnant women and children under 19 and disabled folks before they turn 65. But again, there are some seniors that are eligible, especially the ones that are in nursing homes. So if you have other relatives or friends or stuff that are in nursing home and don't have significant assets, then they're likely to be dual eligible for both Medicaid and Medicare. And in Texas, they'll be in a thing called Star Plus. So you hear about Star Plus. These are all the other managed care programs for other people that are eligible for Medicaid, but the one for seniors is Star Plus that you might hear of if you're also in a nursing home. So if you are in that kind of situation, effective September 1st, WellPoint is not going to be offered anymore in Houston, but Community Health Choice will be. Yay, Community Health Choice. This is something that we started down this path before I left 5 years ago and finally got it done. But you'll have to pick either Community Health Choice, Molina, or United Healthcare if you're dual and want to be in both a Medicare Advantage special needs plan and get the nursing home coverage. And there's a few other things that it covers. It's not just nursing home, but that's the big ticket item. This we'll talk about later about how do you actually sign up for this. I do have to have a quick thing in case any of you are under age 65 or have no other people there are. You know, there are really good subsidies for people to buy private coverage, an individual policy under the ACA. You know, it's kind of complicated, but you know, a lot of people that have employer-sponsored insurance may not have employer-sponsored insurance because they work for a small company or they're independent contractors and just have their own small business or something like that. Then they have an opportunity to buy insurance directly and not be excluded for pre-existing conditions or anything after the Affordable Care Act. So they can buy a policy and they do get subsidies for that. And this is where you've probably heard about bronze, silver, gold, platinum plans and stuff like that. That's just a way to differentiate the amount of co-payments and deductibles that people have. But again, this is for people under age 65. Or if for some reason you know somebody that's over age 65 who's not eligible for Medicare, for some reason, they're actually still eligible for these programs as well, okay? And there are significant subsidies that you get. You get a premium tax credit, i.e. a subsidy to pay your monthly premium depending on your income, and also depending on your income, you get an opportunity to have your deductibles and co-payments reduced. And this is growing really fast. 21 million people now, 3.5 million in Texas have individual insurance. 10 years ago in Texas, there were less than 100,000 people or something like that that had individual health insurance. But since they said insurance companies have to take everybody, no matter what their situation is, this has really grown really fast, including a lot of small employers who's like, I'm not going to offer a small group plan anymore, but instead just let all of my individual that work for me, I'm just going to give them a stipend to go buy health insurance for that. So a growing thing. There are also, just to remind people, since I used to work for Harris Health System and Community Health Choice, I have to point out that there are county indigent care programs, and in Harris County we have a very robust one. And so if there are other people in your family or in your neighborhood or whoever are not eligible for Medicare, not eligible for other insurance, there is the opportunity to go to the hospital district and get really quite good care as long as you use the hospital district clinics and their hospitals. There's also people that go to other federally qualified health centers like Legacy or a bunch of others, El Centro de Corazon, that will treat you even if you're uninsured, and charity clinics like San Jose Clinic in Midtown and others. So I will do a quick shout out for the University of Houston Family Care Center, which is a new clinic that we've started with the medical school and is in the process of becoming a federally qualified look-alike so that they will treat people. And this is one of the new clinics here in the Third Ward that are will see anybody, no matter what your insurance status is, even if you're uninsured. Here's some of the places for those of you who like websites and stuff can go find out more about the Harris Health System, the community health centers, ACA, Medicare, and Medicaid. So I will stop and see if we have a few minutes for like technical questions for me, but do know that we're going to bring the panel up in just a minute to also to have some discussion about some of these things. But questions? Yes.
Yes, I have one. You mentioned that the complications of the system itself. What resources are available for acquiring that agent that you referred to help you with navigating health plans?
There isn't a good system for that, quite honestly. There are a number of organizations. One that I work with quite a bit is called Civic Heart. It used to be called Change Happens. Is that right? Yeah. That have navigators that will help you. There are a growing number of folks. How do you find? We'll come back to that question when we get the panel up here in just a minute, because we have an agent here on the panel that can also talk about ways to find them.
One more that I think is pretty funny. When you stop working and you're over 65, you get Social Security, but it turns around and it's counted as income when your tax return.
Yes.
Is there any legislation coming eventually where that income is not considered taxable?
I'm going to try not to be terribly political and just say that given our current situation in Washington, D.C., I think it's gridlock, and I don't think anything helpful is going to come out of D.C. anytime soon. It should be fixed. There should be, but there's also then the way they count, revenue and stuff, and how much tax revenue they lose because of that is. It's just add that to your list of messes in Washington, D.C. I really do think that most of the questions that you guys will have will be able to answer better on the panel, because we have other experts. I'm kind of the high-level, big-picture guy, but there's other people that live on the ground helping individuals do this stuff, and so I really want to, why don't we just jump to the panel?
Let's give everyone Dr. Yanda a hand, please.
Yes, sir. Thank you so much, Dr. Yanda, for that. Appreciate it. And thank you, everyone, for participating and being engaged. We really are excited for this. I'm going to go ahead and just introduce members of the panelists. My name is Nkechi Ogbo. I'm with Texas Southern University, and my title is the Health Equity and Community Engagement Pharmacist there. So it's my pleasure to introduce the panelists here under also the leadership of Dr. Ajewole. Let me see, forgive us. All right, I'm just quick sidebar, just a bit. Please feel to use your Q&A cards again for on-site attendees, and we are very open. We are checking the Q&A box online to our attendees online, so please feel free to use that. In no particular order, I'm going to invite the first member of our panelists, and this is the person of Mr. Shonbay Jones with Social Security Administration. He is a public affairs specialist for Social Security administration here in Houston and surrounding areas. Mr. Jones began his career with SSA in 2010 and has worked in various positions within the field offices. He definitely has extensive knowledge of all Social Security programs and is a public servant at hand. Please, can we give it up for Mr. Jones? Thank you, sir. I appreciate you. Thank you for your time as well, sir. The next person is Ms. Benita Powell, and she's with Lucas Powell Insurance Agency. She is an accomplished insurance agent, and she holds licenses in property and casualty insurance, including the coveted Group 1 license. She has a record as being a top sales agent, and which speaks of her dedication and expertise in helping clients find the right coverage. She also specializes in Medicare sales and conducts informative seminars to empower individuals with knowledge. Ms. Powell also specializes in the following areas: in Medicare sales, which helps to guide seniors through the complexities of Medicare plans. She also helps with life insurance, not also that, but also with insurance for younger family members, as well as additional products such as dental plans, cancer insurances, vision coverage, and hospital stays and home care. Now, outside of our work, Ms. Powell is a proud Houston native, navigating life as a divorced parent of 3 wonderful children, and her hobbies include spending quality time with her family, active participation in church, activities, as well as exploring new destinations through travel and whipping up delicious meals in the kitchen. I second that. Thank you, Ms. Powell. Can we give it up for Ms. Powell as well? Okay, last and not least is Mr. Anthony Schrock. He has MHA and MBA, Director of Revenue Cycle Management, also at the U of H Health Family Care Center. Mr. Schrock is a native of Dallas, Texas, attended high school geared towards health professionals, that's cool, which is where he developed his passion for improving the accessibility and affordability of our healthcare system. Mr. Schrock also earned his bachelor's degree in business administration from Texas A&M, University of Commerce, and he later attended University of Texas at Arlington, where he received a Master's of Healthcare Administration and a Master's of Business Administration degree. He definitely brings with him over 10 years of experience in the healthcare industry, and his roles range from front and back end revenue cycle, behavioral health case, utilization management, and training and development, and healthcare operations. Mr. Schrock currently serves as a Director of Revenue Cycle Management at the University of Houston Health Family Care Center, which gears towards improving the lives of the Third Ward and surrounding communities. And in his role, Mr. Anthony also leads all billing and credentialing activities, a team of certified navigators and application counselors assisting patients in applying for state benefit programs, marketplace coverage, and or clinic eligibility programs as well. Please, let's give it up for Mr. Schrock. Thank you. And Dr. Yande, I'll give this over to you. Thank you.
All right. Thank you all for being here on the panel. I do have to do a quick shout out for Mirla Lopez back in the who's also with the University of Houston College of Medicine and leads a lot of the team of community health workers. She's also another great resource for helping people navigate the complicated healthcare system that we have. But I'm just going to jump into a couple of questions, and then we'll have plenty of time for other folks to have questions first. Okay, so the first question I actually have is for Benita. It's like, okay, what did I get wrong, right? Or
just going to expound on a couple of tricky things here. You mentioned the Medigap, and you guys like to interchange Medicare Supplement with a Medicare Advantage program. Actually, Medicare Supplement is the same as a Medigap plan. A Medicare Advantage program is totally different. Medicare has 4 parts, A, B, C, and D. A is your hospital, B is your medical, D is your prescription drug, and C are the private companies that you can get your Medicare Advantage program through. You have an MA plan, which is a Medicare Advantage program, and then you also have an MAPD plan, which is a Medicare Advantage program with a prescription drugs. Usually the individuals that start with an MA plan usually are the ones that have a prescription drug plan through the VA, or maybe they retired but they didn't have medical, but they have a valid prescription drug program, so they'll just get an MA plan. When you're wanting all of it together, then you will go with a Medicare Advantage program with the prescription drug inclusive, and then you would choose Part C, which is your Aetna's, your Blue Cross and Blue Shield, your WellCare, your WellPoint, et cetera. You have any questions?
I'm glad when you explained it also, it's like, oh, wow, there's lots of options here. But I put just sort of no. But that's the reality. It is complicated. But let me go to Chande for a second. Talk a little bit about how the mechanics of work and sort of getting signed up for Social Security and getting your Part B premium paid for. Could you talk about that a little bit? Because no matter what, you got to pay your Part B premium.
Social Security, just understand, Medicare is its own government entity, but all enrollment for A and B go through Social Security. So you can't go anywhere else until you stop at Social Security first, okay? Like they mentioned, Part A is your hospital insurance, Part B is like your everyday medical insurance you have through work. Now, when you turn 65, you basically have a 7-month rolling window, right? 3 months before the month you turn 65 and 3 months after you turn 65 to enroll in that Part A. Now, like he mentioned before, if you're currently working and you have insurance through active employment, I'm gonna stress the word active employment, right? That's not VA insurance. That's not, hey, I retired from the University of Houston, they're gonna cover me for life. It's through active insurance from either yourself working or a spouse working. You have to be covered under yourself or a spouse. Because like you mentioned, there's something called a special enrollment period. So like when he comes in, there's 2 forms that have to be filled out. So if you say, hey, I'm not gonna take Part B, I'm gonna enroll when I decide to leave my employer, there's a form you have to fill out telling us when you want the Part B to start, and there's a employment verification form. They have to verify you've had health insurance through active employment since the age of 65. It's really important that you turn in both forms at the same time, because if you turn in just the enrollment form, we'll enroll you. But understand, if you don't have active active insurance through active employment, there's a 10% penalty for every year you don't have Part B if you do not have insurance through active employment. So people come in all the time and they say, oh, I've been covered, and then we look at the coverage through VA, or maybe it's through like a work insurance that they have because it's gonna cover them from life, but maybe now they have to go into a different network than the VA or somewhere, so they wanna enroll in Part B. Our other enrollment period is our general enrollment period. That's January 1 through March 31st every year. Once again, you can only enroll through that general enrollment period. The rules have changed last year. Before, you would enroll January through March. It wouldn't start until July 1st. As of last year, now if you come in January, it starts in February, March, April. So you don't have to wait until July any longer. But just understand, if you do not file or qualify for the special enrollment, then you do have to go to our general enrollment. You cannot enroll outside of that general enrollment. So if you don't fall under the SEP or special enrollment period, you do have to wait for that general enrollment period. What else did I miss that you asked? He mentioned the Part B. If you elect to take, say, a lot of people take Medicare, but not take their retirement benefit at that time, then you do have to pay Medicare directly to them. They will bill you directly on a quarterly basis. Once you start getting your benefits from Social Security, it will be deducted out of your Social Security check.
Good, thank you. It's funny, so like, my whole family, I'm one of 6 kids. My whole family sort of relies on me to know all this stuff, and yet you don't. Like, so my brother, who's a little bit older than me, retired from being a school teacher, and because his wife was from Sri Lanka, they moved to Sri Lanka. So he's like, well, I'm living in Sri Lanka. I don't need to sign up for all this Medicare stuff, right? I don't need this coming out of my paycheck. Well, he decided to move back, as we sort of all figured he would. Not that Sri Lanka is not nice, okay, but they moved back, and he's now in this 10% penalty. It's like, and for the rest of his life, he's going to pay more for his Medicare because he didn't sign up until he was like 69 or 70 years old. So if you sign up, is my message there. So you talked about the fact that Part B premiums. I will also tell you, when my wife retired, she didn't take her Social Security benefits right away. So we were also one of these people that was like having to pay quarterly for her Part B, even though she picked a Medicare Advantage plan. So again, you know, once you do start getting your Social Security benefits, then it actually is a lot easier. So let me turn to another question, and I'll start with Benita, but others can jump in as well. Can you talk a little bit more about the additional premiums that you're seeing? You know, I hit kind of high level sort of the range of some of these additional premiums that people have to pay, but you know, in addition to the money that's coming out of your Social Security check, you know, the Medicare supplements, the Medicare Advantage plans can charge an additional premium. Can you talk a little bit more about that?
Okay, on the Medicare supplement, if you decide to go with a Medicare supplement / Medigap policy, you are going to have an additional premium above the $174.70 that you're paying for your Part B premium. It can vary according to what your age is and also according to what plan you choose for that Medicare supplement. With a Medicare Advantage program, you still have to, and you must pay your Part B premium in order to be, because remember, Medicare Advantage, you have to have A and B to be on their plan. So even though you're on a Medicare Advantage program, you still have to pay your Part B premium. Some of the plans now are not charging any monthly premium, whether it's an HMO or a PPO. Now, when you're going with an HMO plan, you do have to be mindful that you stay within network. If you go outside of the network, then you are going to be responsible for all of those charges that you have accumulated by going to a doctor that's not in network. That's one of the things that I tell my clients, that when you are on a Medicare Advantage program, the doctor sends you for a referral. And he says, I want you to go see Dr. Smith, the cardiologist, and they're in network. First thing you ask them is, oh, is there in network? And the doctor's office says yes. But I also tell my clients, it's your responsibility to make sure you call and find out if that doctor is in network with your plan. Be mindful that when you do call, you say, I am on Aetna Medicare, I'm on Blue Cross and Blue Shield Medicare, because these plans have commercial plans. They also have ACA plans. So just in case you call and you say, oh, I want to see Dr. Smith, and they say he's on Aetna, and they're going to say, yes, he takes Aetna, but he may not take Aetna Medicare. So by you going to that doctor will have you to accumulate charges because you didn't make sure that that doctor was in network. Also on your PPO plan, Dr. Young was talking about the staying within network. You do get an out-of-network benefit and you do get an in-network benefit. But if you go out-of-network, you're going to pay, depending on the plan, depending on the company, you'll pay 40 to 50% to go see a doctor out-of-network. That's the difference in having a Medigap Medicare supplement versus a Medicare Advantage program, because when you go with a Medicare supplement, you do have that monthly premium for the supplement. You have the monthly premium for the Part B. You also have to get a standalone Part D plan, but it also gives you a little bit more flexibility. You can see any doctor or go to any hospital that takes Medicare, then they will also take your Medicare supplement. And with the Medicare Advantage programs, you're also going to have that cost of co-pays that you're going to be paying to go see the doctor. Some do have co-insurance attached to that as well. And then, like I said, you have that out-of-network cost.
So, yeah, I can talk about it. Pass it to Anthony, because Anthony, talk to us a little bit about the doctor's offices and, you know, the challenges that you guys have, one, getting signed up with all these Medicare Advantage plans, and then helping patients sort of navigate that, you know, more from the doctor's office.
So yeah, with the Medicare Advantage plans, our biggest issue is making sure that you all understand your benefits and the differences between the traditional Medicare and the Medicare Advantage. We partner with people like Benita to help you choose the best Medicare plans. So we just want to make sure that you understand your benefits for the most part, and we are referring you to people that are in network with you.
So who all are you guys
Yeah, so we still are a fairly new clinic, and we are on most major plans. The only plan that we aren't on right now are Humana. That should be coming by the end of the year, so we're excited to be able to be on all those plans and be able to serve you all should you come to the clinic.
And talk a little bit more about, you guys actually have some navigators that can help people, not just with their coverage, but also, you know, often seniors need other help from, you know, transportation and food and other kinds of issues.
Yeah.
So I'm right that you guys try to help. Try to help even more. You're right. I'm probably not helping the people that are watching online, right, when I don't have the mic on. So, good answer.
Most definitely. We have a great team of physicians, medical assistants, eligibility team members, and as Ken talked about, merely with the community health workers to help navigate all these things. So when you come to the clinic, we'll talk to you more about if you're having issues with food, transportation, and we have lots of resources to help navigate and choose those things for you. So partners merely with community health workers, Benita, and other community organizations to help you choose those things so you don't have to navigate this blindly.
Yeah. So talk a little bit more and then pass it back to Benita about it, because we had the question earlier about how do you find somebody to help you with this?
Yeah.
You just take Benita's card, actually, I think is what you do, and just call her, right?
It's on the table in the back, you guys. Just like myself, I've been, this is my 31st year of doing this. And so in order to do this, you have to want to help a person. And when I sit down with my clients, I make sure, the first thing I say, well, you say, Benita, can you come out to my house and talk to me, or we talk over the phone? The first thing I'm like, okay, I need to have all of your doctors, I need to have all of your medications, and I'm not talking about the doctors that you're currently going to, but if you went to a doctor last year and you think you might want to go to them a year from now, I need that doctor as well. And that's very important. Even if you're doing it over the phone, or if someone is doing what we call tabletop, sitting at your kitchen table, or doing it, you know, at any event like this, you need to make sure that they have all of your doctors, all of your medication, because that's where you get all of this gruntledness to saying, oh, well, they just signed me up and they didn't ask me about this, or my doctor's not on the plan because it wasn't asked. So if someone is sitting in front of you, be it me or anybody else, and they're not asking you these questions to make sure that they're looking up your doctors, looking up your medication, making sure that your preferred choice of hospital is in network, then, you know, that's a red flag. I want you to be cautious about that. Also, you also need to know about, if you don't mind me going.
Keep going.
The enrollment periods. These are very, very important. We are coming up with an enrollment period which we call AEP, the annual enrollment period. That's from December the 7th to, October the 15th to December the 7th. And at this particular point in time, you are then able to enroll in a plan to be effective for January the 1st. If by some choice you get in that plan, I don't want to do this, I made a mistake, then you have what they call open enrollment period, which is from January the 1st to March the 31st. And at that point in time, you can change one time from the plan that you chose the year before. After the 31st, you're only going to have what they call SEP, Special Enrollment Period. And that is going to be from April the 1st until we start AEP again, okay? Now, if you are a dual eligible individual, you can enroll by quarterly, okay? Once every quarter. The special election period are going to be for people that have what we call low-income subsidy or the extra help programs. They too can enroll every quarter, or if you're moving into the Houston area, or if you are moving out of the current service area of your plan that you have right then. So these are things that are very important for you all to know when you're trying to navigate the Medicare Advantage system, okay?
Just wanted to reemphasize something that one word that's on this slide behind me, where it says that you need to find a trustworthy broker or agent. Unfortunately, in our business, there are some
Shysters.
kind of sleazy people that, because, you know, Bonita gets paid by the insurance companies a commission to sign people up. And so there's unfortunately, some not very scrupulous people out there that will sign you up for not the right plan, but the one that they get the commission from. Or because some, you know, Bonita has a contract with lots of different insurance companies to do this. So she's not going to always send you just to Blue Cross, because not that anything's wrong with Blue Cross. There are agents that will, like, everybody needs to be United Healthcare because that's who they have a contract with. Right. You want to find somebody that has a contract with several different companies so that they can actually say, okay, which doctors and nurses, what plan works for you, what prescription drugs, because, you know, especially on the prescription drug side, there's what they call a formulary and different, and you want to make sure that the drugs that you're taking are going to be covered at the right lower copayment levels and stuff. And so it's important to find somebody that you can trust, that has your interest at heart, and somebody that's, like, yeah, doing this for the right reason. And so I don't mean that to be not that Bonita is the only one. There are 90% of the guys out there or gals that are doing this are really good at it. But watch when somebody tells you something that's too good to be true.
I agree with him 100%. If I could duplicate myself more often, I would, and I'm not just saying that to pat myself on the back, but you do have people that are just in there and they move their book of business from one year to the other. They're not thinking about you as a person, what's best for you. I sit down and I talk and I ask questions, and I'm not trying to be intrusive, but I ask the questions so that I know what plan to put on. And that's one of the reasons why I am a broker, is because I want to make sure that I put you on the best plan for you, not the best plan for me.
So what did I miss, Chandra, on stuff that you wanted to make sure that people knew about today?
Just to circle back, if there's Harris County has an office on aging, so they don't just help with, like, any elder services, or if you want to contact, say, whether it's through the Medicare, you can't find that trusted source, you can't get a hold of her. Harris County, Galveston County, all each have an office on aging. That's a state agency. So that may be your first stop for really anything elderly services. So just don't forget that you do have that out there. There's no fee. You don't pay anything to go in and sit down with them. So we say, hey, I just want to see what they have to offer. They do everything from Medicare to in-home services, things like that. So definitely you can Google it. I don't work for them, but I know that I do a lot of programs with them. So they do a lot of services for the elderly. As far as cost, when it comes to what I can say on the Social Security end, he mentioned that Part A is free, and it typically is. But in order for that to be free, you do have to pay those Medicare taxes, what's called your 40 quarters, over some years, because if you do not have those 40 quarters in Medicare, it can cost up to $505 a month. That's the Medicare Part A. That's not including your Part B. So you'd pay, some people are paying $505 a month plus the $174. Now, you can be insured through Medicare from your work or a spouse's work, all right? That's a current spouse or a divorced spouse if you were married at least 10 years. So just understand, if you were to stay at home, husband or wife, and you do not have your insured quarters through Medicare, then you can actually insure you through your husband's record. But I just want to clarify that Part A is typically free, and it is for most. If you've worked, it's going to be free. But there are some people that come to us and they cannot afford the Medicare Part A, and sometimes that's why they do not enroll. He did mention something as far as higher wage earners pay a higher premium for Part B outside of the 174. It's something called IRMA, or Income-Related Monthly Adjustment Amount. So if you are a higher wage earner, you'll pay 174 plus additional fee. Now, that's only for that current year, and they look at your income from 2 years prior. So we're in 2024 now. They look at your income from 2022, and Medicare will say, hey, this Sean Bay has to pay a higher premium. It's only for that year. In 2025, they're gonna look at my 2023 income. Now, we do have something called a life-change event. So if you fall into that IRMA and you say, hey, I'm paying this premium, and say you retire, a spouse passes away, you sell your business or something like that, then there's a form you can fill out, and we can possibly get you back down to the base rate of the 174. But just understand it's only for 1 year. Some people get that notice and they think that that's for life. It's only for 1 year, but if there is a life-change event, we can actually reduce it back to the base premium of the 174.
Yes, we learned that one too when my wife retired, because she had, like, in January, a big payout. And so then it was like two years later, then it's like, whoa, wait a minute, she didn't earn anything last year. So we got that fixed. Anthony, anything that you want to make sure you say to folks before we turn it open to questions out there?
The only thing I would add is, I know we talked about Medicare here today. I just want to add that we do have a team that will work with helping you qualify for Medicaid or Marketplace should you not qualify for Medicare as well. So helping to navigate and find coverage for all pieces of it.
Yep. All right. So questions that you guys have, and we will. Okay. You're going to be our mic.
Okay, I have two questions. I'll ask them both so I don't have to be coming back. The first one, you mentioned something about health care in Third Ward. I have a family member that's homeless, that's on Medicaid, and I wanted to know about the health care you mentioned in Third Ward. That's one question. The other is about enrollment in Medicare. I've been on Medicare for 65 years, but I'm a veteran, so I go to the VA for my health care. But do I have to enroll in Medicare every year? I don't use it, but I have it.
So you can't every year. So really, you may be one of the ones. I use as an example. So if you have the VA currently, you may or may not have Medicare Part B. You have Medicare Part. Okay, so you're okay. There's no for Social Security, and there's nothing you have to do. Once you enroll in the Medicare Part A and B, it's not going to stop unless you actually terminate. You can't terminate Part A, but you can enroll and disenroll through Social Security for Part B. So some people may say you take Part B and you go back to work and you have insurance through active employment. You can stop your Part B at that time and take your health insurance through your employer and then re-enroll at a later date. But if you have Part B, you're not working, and you already enrolled, there's nothing you have to do.
But should you?
You're saying that I can disenroll in Part B if I want to, that $174, I can disenroll in that?
Yes, ma'am, you can. But if you understand, if you only have VA and you're not working, if you try to enroll at a later date, for every year that elapsed, you're going to pay a 10% higher penalty. Now, if you really truly believe in your heart that, hey, I'm never going to use my Part B, I'm only going to go to VA hospitals for the rest of my life, you can disenroll in Part B. Now, understand, when you disenroll, it's the month after the month you disenroll. So if you disenroll this month, it'll stop billing you 2 months later. But yeah, that's a personal choice. Now, I'm not going to tell you to disenroll or not, but think very strong on whether or not to do that, because to get back into it, one, say you're trying to enroll back in May and something happens, you get sick. You can't enroll back in Part B until the general enrollment, which is January through March, and it starts the month after. So I don't recommend disenrolling, but you have the option to. Medicare Part B is optional.
Okay, thank you.
Yeah. So, did you want to add something to that? And then I wanted Anthony to talk a little bit about what resources in the Third Ward.
Also, ma'am, even though you do have the VA, you can also get on a Medicare Advantage program, so that, sometimes you have the long waits at the VA. You can also get on the Medicare Advantage program and go to whatever hospital you want, and it doesn't cost anything. It's just an option. No, ma'am, it does not. You can have the VA and you can have the VA as well as having a Medicare Advantage program.
Yes. So you mentioned you have a family member needing care in Third Ward. We are at the edge of the University of Houston campus, and so you don't have to go in the campus. We're right on the edge, and we are the UH Health Family Care Center, and we take all Medicare and Medicaid. So more than welcome to help and assist you there.
But there are other clinics in the third ward, and the healthcare for the homeless program.
Forget about that.
I can't do that off the top of my head, but afterwards, we can give you some additional locations.
I have a question about Medicare. I have a friend that getting the 174 taken out, but they had additional tax takeout. What's the advantage to that?
You can have the federal taxes come out of your Social Security check. I know someone earlier, benefits taxable, and the answer is possibly. It really depends on your combined income. So they look at your Social Security, any pensions you may have, if you're still working, things like that. So most often for people that have planned properly for retirement, you are gonna, the benefits are gonna be taxable, but you don't, having taxes come out is optional. There's a form you can fill out, it's a W-4V form, you turn that into us, and we can start taking federal taxes out. Now you can stop that at any time or adjust the amounts or percentages at any time also. So the advantage is at the end of the year, you know, those taxes are taken out and you don't have to pay anything. But that's more of a tax advisor question. But a lot of people will that either have pretty decent income coming in or are still working, they will have the taxes come out of their Social Security check.
Other questions?
Sir, a quick question. I'm still working. Just recently turned 65. Just a little clarification on the open enrollment for Part B. Is it January? You said January through March?
No, if you're still working, you fall under the special enrollment period. So you can enroll whenever you would like, as long as you have insurance through active employment. I would just recommend, if you know, hey, I'm going to leave my job in January, just do it a couple months out, because processing is going to take about 30 to 45 days.
Okay.
So
okay.
no, there's no enrollment period for you. It's really whenever you decide to leave your employer.
Okay, but do I still need to go ahead and have them fill out that form saying that I currently getting insurance?
Yes, if you're going to enroll recently, it's a CMS 564. It's an employment verification form.
Yes.
But they'll fill out you've had insurance through age 65 up until you want to enroll. But if you're just turning 65, there's nothing you need to do until you want to enroll. So if you plan on working the next few years, wait until the next few years when you're actually going to leave your employer. You don't have to do anything right now if you're just turning 65. Now,
Okay.
you do have to file an application if you want to enroll in Part A. There's no automatic enrollment. You have to call us, or the application can be done online. So you do have to enroll in Part A, but you do not have
I'm
to
already
take.
getting A. I've
Okay, so
already got
yeah.
that
So if you're
already.
going to leave your employer soon, within the next few months, yes, get those forms completed and get those over to us. If you say, hey, I'm still going to be here for a year or two, then just hold off a little bit.
Okay, all right. But I can't wait until January. You said open enrollment is January through March, where I won't need to get the form from the company I'm currently working with?
No, so there's no date specific to you. It's when you actually leave your employer. You leave your employer in May, and you can start your Medicare Part B whenever you want. The general enrollment period is January 1 through March 31st. That's for people that are not entitled to the special enrollment period that you're entitled to. So like I said, there's no specific date you need to enroll. It's whenever you're going to leave your employer and you're no longer actively working and you have that insurance, that's when you need to enroll in Medicare Part B.
Okay, thank you.
So the example for me, just as an example, so at University of Houston, I'm in a non-tenured position, so they could get rid of me at the end of my contract next August. And so if they did, then I would, next August, sign up for Part B. But I'm not going to sign up for Part B until I'm not covered by University of Houston,
Yes.
Right? We had another question somewhere.
This gentleman right here. There you go.
Oh, okay, thank you. I just got it on. Push it. Okay. My question relates to the navigating the health system. If you have conditions that require hospitalization or conditions that, like people who get sick. I can remember when I was retired, I wasn't, had a lot of complications, but now that I've been retired for some years, I've developed some complications. And I have to be careful, and I think Ms. Benita is familiar with this. I have to be careful when I travel, because when I travel to go see relatives, I'm out of network. So those plans that you were referring to, that agency navigating through there is quite important for people when they start selecting these plans. Right. They got to recognize that they may be pretty good health now, but what happens when you get down the road, when your health turns, or if, and it's nice that the period of re-enrolling is every year. Right. Because when you do get sick, you can re-enroll in something else that's better for you.
If you're traveling short-term and in the United States, they will have, the Medicare Advantage plans will cover you for your emergency care. If you're traveling outside the United States, maybe not. So you got to be careful if you're outside the States. But if you're regularly traveling, like, I have some friends that they go and visit their children and are there for months and stuff like that, so they may need more routine care, then you really do have to be very, very careful about what kind of services you're trying to get outside your normal service area. And so that's one of the reasons why some people that do a lot of traveling will do a PPO plan, so that they at least have some out-of-network benefit. But it also may be one where if you're doing a lot of traveling, you may actually be better off with traditional Medicare and a Medicare supplement or a Medigap policy, because then you're going to be covered at that higher level out of network. I see. Is that a negative thing? We're 3 minutes over time. We're still okay to keep going? I'm fine. I thought we were going until 12:30. So.
Yes, Benita, I'm assuming I'm gonna have to call you because I did explain to you a little bit about my situation.
Yes, ma'am.
I'm not 65, I got another year, but I actually get Social Security disability. And I know most places, I have Medicare A and B, and I was listening to what you all was saying, I'm learning a lot. It's a little expensive, it's through the job. So therefore, by me not quite 65, I have to wait till I'm 65 to get another, not saying changing Medicare, but get another supplemental plan. I have to wait, huh? I can't just drop my supplemental, Blue Cross Blue Shield.
Is that from your job?
Yes, for my job.
Okay.
It's pre-65.
Now, that's something we're gonna have to talk about
Okay.
offline. That's
Yeah.
gonna be a little bit more tricky. Okay, that's something we talk offline on.
Because it's just like what he said, you have to be very careful because it's a little scary.
Exactly.
Even though, I had health issues so far so good, 10 years, diagnosed 10 years ago, with cancer, but so far everything is excellent. And on no medication and none of that. But it's nervous because I don't want to drop that and I'll be like, oh Lord, I need that plan, it's scary.
We definitely would have to talk about that because I don't want to go.
Okay. Okay.
Okay.
Okay, thank you. Mhm.
I think we are good on questions, everyone.
And I did bring some pamphlets on just general Medicare pamphlets. I also have a form back there that tells you who you need to contact for certain situations. Because a lot of people call us when sometimes they call Medicare, or they may call Medicare and need to call Social Security. So there are some forms on the table back there if you got to grab on your way out.
And there's also information on the Family Care Center for U of H that is back there, as well as the Healthy Connections program that we call it, where there's community health workers that can help you navigate and find the Bonitas of the world and other kind of resources that you may need. That you don't have to be a patient of the Family Care Center to call Mirla and her folks to do that. And they're also very good at finding other resources in the third ward, because they really focus a lot on services in the third ward. But this has been great. Or you're going to do it looks like Virgil's going to do it. I want to thank you all for your attention and stuff. And again, I just want to apologize for all of you for what a messy system that we have created, you know. And part of it's politics, and part of it's employers, and part of it's insurance companies. And what I always say to everybody is, you know, we're all part of the problem, no matter where you are in the system, but we're all part of the solutions too. And so we all, you know, please keep raising the questions and the problems and stuff, because there are opportunities, you know, through legislative stuff, through regulatory things. Really, the folks at Social Security are wonderful. You know, sometimes people think, oh, they're just government bureaucrats and they're going to try and figure out a way to deny me coverage or something. You know, the people that are in the business, the vast majority of them really want to help. And so do feel free to reach out to any of us at any time.
I do want to mention, so he was talking about this, the source of information. So I help a lot of people that have issues with Social Security problem, whether it's enrollment Medicare, survivor benefits. If you have questions on Medicare A and B enrollment, get it from Social Security. We have something called equitable leave. If I give you misinformation, guess what? I can fix the issue for you. If someone outside of our agency gives you the misinformation and you don't enroll and you enroll, they cannot fix it. So I do want you to understand, if you have questions, go to the source. All right, just understand, because if you go say, hey, someone comes to me and say, hey, well, my employer told me not to enroll, I can't really help you. But if you say, hey, Sean Bay said don't enroll, guess what? I can help you, okay? There's something called equitable relief. If there's misinformation from someone within our agency, we can fix the issue for you. So just understand, when you have these questions or if there's a gray area, please contact the source, and just don't hear from the uncle, the aunt, or even sometimes the insurance providers, things like that. So I just want to let you know, because I try to fix a lot of issues, and sometimes I can and sometimes I can't. But if you speak to someone, get their name, the office they work at, things like that, and then, you know, typically it's really easy for us to fix any issues you have with any of our Social Security programs.
Amen.
Good deal.
But you're not going to tell people to sign up for Community Health Choice, though, right? Or, yeah. Bonita can, though.
All right. Can we give them a round of applause, everyone? Again, we want to thank you guys for joining us today for the Navigating the Healthcare System, the Health Education Seminar. Again, for our folks online, please complete the survey. Also, for our people here in attendance, if you'll complete the survey in the back of the room, if you haven't received one just yet. Just give you a couple of updates, what we have going on in the next couple of months. So next month, we'll be doing a huge event with Let's Talk About Prostate Cancer. That's going to be on 3106 Page Street over in 3rd Ward at Progressive New Hope Church. That's going to be Saturday, September 14th, 10 a.m. to 2 p.m. So we do have flyers in the back on our table with Miss George and Miss Dolores. If you'll raise your hand, they'll give you guys those flyers. Also, our We Roar Against Breast Cancer, a huge major event, one of the most, I'll say one of the most important events that we actually have throughout the year. That'll be on the TSU campus. That's going to be October 18th on a Friday, October 18th from 11 a.m. to 3 p.m. We have a whole day of activities planned out for you guys, so we love to see you guys there as well. As stated again, I'm Virgil Elkins with TSU Community Engagement Corps. These are our monthly health education activities, as well as our conferences and outreaches. So that information is on our table as well. As stated before, it's going to be September, it's going to be prostate cancer. October is going to be breast cancer. And then in November, we'll be going over the sexually transmitted diseases, and that'll be taking place at University of Houston on the actual campus there. I'll give you a couple of minutes to take pictures there, or a couple seconds, excuse me. And as stated before, thank you for connecting with us. Thank you for joining us today. Please give a round of applause for our panelists. Great, wonderful job. We really appreciate you guys. A lot of wonderful, informative information. You can follow us on our social media apps. Also, if you have any questions, you can reach me, 713-313-1233, and it's on the information on the back tables. Please stop by the tables and pick up the information that our wonderful panelists have provided for us. Thank you for joining us.
I want to say a big thank you to each and every one of you for joining us for today's program. I am very certain that you have received a lot of great information that you will put to practice as we all grow together to become a healthier community. Thank you to our speaker and our panelists. Thank you for sharing today's content with us. Thank you to our locations. Thank you to our interns, our volunteers, to our sponsors and our funders. Thank you also to the staff of our program, the faculty, and the leadership of Texas Southern University for supporting us in making today's program a success. Most importantly, I want to say thank you to each and every of you, the community members. We appreciate your support. We do not want today's program to end just with today's event. We want you to continue to collaborate with us and engage with us. Our social media platforms are located at CECTX Southern U. On those platforms, you will find engaging information from today's program and all the other programs that we have going on in the Community Engagement Corps. So we implore you to continue to stay connected with us, engage with us as we move forward together in building a healthy and a wealthy community. Thank you for joining us, and we look forward to connecting soon. Bye.